Good morning, everyone. I am a social historian, and I've been active on the marijuana file in Canada for over 7 years, and I have the following to say. The public is up against a narrative that is at war with science. The marijuana lobby deceives by saying consuming has no lasting negative impact. They deceive by denying cannabis hypernemesis syndrome and addiction. The DSM-5 establishes clearly marijuana is highly addictive. Every week, patients on MJ enter the Denver Health Center ER and must be restrained so as not to harm themselves or others. In casual users, THC can disrupt working memory and focus for 24 hours, says Harvard researchers. The true believers of cannabinoids, there can be a placebo effect, but it is critical that all be informed of the risks associated with CBD and THC. This includes pregnant women and the risks to the fetus, including developmental damage and DNA damage. In 20 years of research on human cells, I have never found any other drug, including heroin, to come close to DNA damage caused by marijuana. Dr. Hugh Davis at Health Canada, even minuscule amounts of THC are not safe for human consumption. Health Canada warns men not to use MJ if they wish to have children. MJ products put young adult males at risk of the most aggressive type of testicular cancer. The FDA must respond to the malevolent billionaires' marijuana experiment that has medical professionals in states of extreme anxiety over the damage industry profiteering has inflicted on the public. Epidiolex, the only FDA-approved CBD product approved for Dravet and LGS, package warnings include suicidal ideation, driving impairment, and hepatocellular injury, requiring liver function testing before starting. Are there such warnings for CBD products being sold at Walgreens today? Are consumers buying Whoopi Goldberg and Maya CBD THC rubs informed of these risks? With 30,000 marijuana studies and high-potency product research entering biomedical literature, reclassification is but an attempt to access the U.S. banks. We changed the conversation, now we change the law, and most the lobbyists. The FDA must take back this conversation and protect the public. I would encourage you to call Dr. Hugh Davis from Health Canada, who in the late 1990s did a risk assessment of THC and found that even minuscule amounts were not safe. He was fired, that science was shredded, and the Canadian government lied to the United States government in saying that they had no risk assessment on this drug. The subversion of truth and science and what's going on in North America should cause everyone great concern and reason to pause and do risk assessments on these drugs and analyze the influence of the billionaires and the industry that have influenced public sentiment and dictated a very deceitful campaign. So with that, I conclude. I applaud the FDA for looking into this, and I beg them to not reclassify THC or CBD. Thank you very much.